Hello, hello. Thank you so much for joining us today. This is our Women's Health Gender Related Nurse Practitioner Virtual Open House. We're excited to have you here. My name is Ashley Chilla. I'm the Associate Director of Admission here at the School of Nursing at Emory, and I'm joined by Dr. Lori Ray, who is the Program Director for this specialty. I'm going to hand it right over to you, Dr. Ray, and she's going to give a great overview of the program, and then we'll open it up for questions at the end.
Absolutely. Thank you, Ashley, and thanks for being here today. If anyone wants to turn their camera on, you're welcome to do that. I love to see your faces, but I understand if you're in a place where you can't do that. Hi, Melanie. All right, so I have a PowerPoint to share, but I'm, of course, so excited that y'all are here and that you want to know more about the Women's Health Gender Related program at Emory. And happy to introduce myself, go over the program a little bit, and of course, answer your questions. Um, all right. So first, just wanted to, again, introduce myself. So as Ashley said, my name is Laurie Ray. I'm the specialty director for the Women's Health Gender Related NP program at Emory. I've been on faculty at Emory since 2021, and I've been the specialty director since January. So almost a year, and it's been a great honor. I really love seeing students, make the progression from novice to proficient. It's really like heartwarming to me every time. I look forward to graduation so much because we're very proud of y'all once you get there. I've been a women's health NP for 14 years, and I'm still currently practicing part-time. And it's a role, a profession that I have gotten a lot of fulfillment out of. I think we do hard work, but it's very important work. And again, glad to know that y'all are interested in continuing it. Also on the slide, I have Dr. Maynor, who's our assistant specialty director. She's been teaching at Emory longer than I have. She's been an MP about the same amount of time. Um, my expertise is more in family planning, sexual and reproductive health. Dr. Maynor has more expertise in like high risk OB and pregnancy related care. So we kind of mesh well in that way. And yeah, we work very closely together, and we would be essentially kind of like your main touch points in the program. Of course, there's many other faculty and staff people who help support the students along the way, but we're the two that you would probably see the most of. Um, and also, I just have my email address there, llray@emory.edu, in case you want to reach out to me later. Happy to set up a time to meet individually or whatever y'all need. All right. And, I assume because you're here, you've been drawn to this for some reason, but I kind of already mentioned, like women's and gender related care, it's a field that I'm very proud to be a part of. There's only out of all the MPs in the US, only about 5% of us are WHMPs. So, we're small, but I think we're mighty. We provide a lot of care that I think is very essential and important, as I mentioned. Um, and in particular, there are a lot of areas that I think we really excel. So things like some things I've already mentioned, high risk OB, complex GYN care, sexual and reproductive health care, menopause management. Um, so, sometimes, and we can go into more detail about this if you have questions about it, but sometimes I get questions about can't I just do FNP and do women's health? And like, sure, yes, you can. There are many FNPs out there who practice in this specialty and do a great job of it. Um, I do think if you know you want to do women's health, you're obviously going to get a much deeper, richer educational experience. And, all of your clinical practicum hours too would be within the specialty. It wouldn't just be like kind of a touch point and then you go do other things. So again, everyone answers that question for themselves ultimately, but just my 2 cents about if that's on top of your mind, then those are my 2 cents about that. Um, but yes, in addition to like the types of care we provide, I think it's also important the way we provide care, and not that this is specific to women's health gender related NPs, but I do think we do a lot of the soft skills really well too. So providing care that's trauma informed and patient centered and um, all of those things. I think we put a lot of emphasis on that in the program, and hopefully it shows up in your practice when you get out there. Um, and again, many of the areas where we excel are things that are of timely importance right now. So, of course, access to abortion and contraception continue to kind of shift in the last couple of years and may continue to do so. Um, we know that disparities in maternal mortality continue to persist, and I know a lot of people are kind of called to this specialty because that's an area that they want to work on. Um, other things too. So even though many types of cancers we're getting a hold on, there are several GYN cancers that actually are on the rise or have increasing mortality rates. STIs, I say, they kind of never go away, and we're actually seeing a resurgence of, in this case, neonatal syphilis. So, there's a lot of work to be done. So I welcome you to to come join us in doing that because there's plenty that we need to do. All right, so a little bit about the program and how it's set up. So all of the NP specialties at Emory are online with intensives. So that means that the actual course delivery happens online. So the lectures are recorded. You'll have assignments within Canvas, which is our learning management system that we use. So those can be things like discussions, case studies, quizzes, and exams, obviously. Um, each semester, there are several times that we have synchronous sessions on Zoom. So we do get on together with our cameras on and again, try to apply the content that you've hopefully already taken a look at in Canvas and again, discuss cases, answer your questions, of course, all those things. And then we also do simulation every semester that you're in one of the specialty courses. So depending on your program of study, especially if you're part-time, there could be semesters where you're not in a women's health specific class. You might be taking patho, pharm, health assessment, other courses. So those courses don't have simulation or on-campus components, but all the specialty courses do. And so those are days that we have set aside that you would be with us together in person in Decatur, where our simulation center is, which is really incredible. If you haven't seen it, I recommend at least Googling it and taking the virtual tour because it's really an amazing resource that we have. So um, sorry, I wanted to mention also, health assessment, there is an in-person component of that course, just FYI. Otherwise, it's all just the specialty courses that have in-person simulation. Um, so wanted to also just mention like a couple expectations we have of students, because of course, when it's a online program, that's a bit of a gift and a curse in some ways, right? So obviously it allows you to be more independent and kind of make your own schedule, figure out for yourself when you're able to look at look at the lectures and do the assignments. But at the same time, you have to be able to do that for yourself, right? You have to be able to kind of make those plans and do the time management piece. So there is a big expectation of you being self-directed, that you remain engaged and in communication with us because again, we're not like seeing you in person weekly. So, with online education, it can be a little easier to kind of just disappear and we don't know what's happening. And so, um, definitely we want you to stay in touch with us. We try to be very available to you. You can make appointments with us essentially any day. Um, we do expect you when we have like our synchronous sessions or our in-person intensives that you come prepared for those. You get a lot more out of it if you are prepared. So um, that's important. A growth mindset. So we know that we're not perfect from the beginning, right? Perfection probably won't ever happen, but we're continually improving. And so just knowing that it's okay to make mistakes, those are expected, and that you're going to continue to improve and grow throughout the program. And then, of course, just being mindful of your professionalism and how you present yourself, that you're also, um, representing the school if you choose us, but also, the profession as a whole when you're out in the world. So those are just a couple of things that we expect from y'all. And then, um, sorry, my keyboard's not working. Okay. Um, and I just want to acknowledge that we do know it's hard. It's a lot to manage. I mean, many of y'all may be working and have families and other obligations, and so putting school into that can be a lot in the mix. And so, um, you know, just acknowledging that we know it's a lot of work. We do think it's worth it. Like I mentioned before, it's incredible to see people go from like day one to graduation. That's what keeps me doing this. And also just wanted to kind of shout out that there are many resources available at Emory to help support you. So if you're finding it's hard and that it's actually a struggle, we don't want you to be struggling. And so there's a lot of resources at Emory that you can tap into. All right. Um, I'm not going to go into this in great detail. You can find all the plans of study online. Um, but this is just an example of the MSN full-time plan of study. You can also do the MSN part-time. So if you do it full-time, it's 4 semesters. If it's part-time, it's 6 or 7. And then the starred classes are the ones that I was mentioning have those on-campus intensives required. So just being mindful of that. Um, Similarly, for the DNP, so we do also offer the Women's Health Gender Related NP specialty in the form of a DNP degree, if that interests you. And so you can do that full-time, part-time, similar setup, same setup, where in terms of the course delivery with the on-campus intensives. I guess at this point, I'll also just briefly mention the difference between the MSN and the DNP if anyone is kind of having that question for themselves. So both, you know, both degrees will put you in position to be able to take your Women's Health NP board certifying exam. So in the end, your actual credential there is the same, whether you did the MSN or the DNP. The DNP, there is more focus on kind of like health systems, leadership, um, you know, of course, you do a DNP project within the DNP program, and that spans multiple semesters. So those are the key differences. Sometimes people think of the DNP curriculum as kind of being like more broad or kind of like zoomed out almost, like you're thinking maybe of a bigger picture. But ultimately within like the specialty courses, the content is essentially the same. Like you're learning to diagnose and manage all the things that are within our WHGRMP scope. Um, all right. So obviously a big component of your experience is the clinicals that you will do. So another key difference between the MSN and the DNP is the amount of clinical hours. So currently, I just want to point out that currently the MSN degree requires 600 clinical hours. This is likely changing soon, like in the next couple of months. Um, so I'm anticipating that for folks who are starting the program fall 2026 or later, we'll need to get 780 clinical hours. So just so you know, um, the reason for that is that there have been a couple of states that actually are requiring more clinical hours for licensure. So, of course, we want to make sure that when you graduate, you're able to get licensed wherever you want to. And so that's part of the reason. Also, the other NP specialties at Emory have 780 hours. So we're just moving to align with them as well. So the DNP requires 1,140 hours, and that's true for all the NP specialties at Emory. Um, and so within that, NCC, which is National Certification Corporation, is our board certifying body. So for all women's health NPs to become board certified, you take your board exam through NCC. So they set the minimum for like you have to have done at least this in order to be eligible to take the exam. So from NCC, they require 600 hours. That's why we've been at 600 hours previously. And they're actually not changing as far as we know right now. Um, and within that, they give a little bit of a breakdown of 240 hours have to be in GYN, 180 have to be OB, 90 need to be primary care. Of course, you'll end up with more than that, but those are the minimums, just so you have an idea. Um, I meant to mention earlier, actually, that sometimes people don't know that within the women's health gender related NP scope is primary care of women. So we do need to be able to diagnose and manage all those kind of common chronic conditions, diabetes, hypertension, arthritis, and common acute things, upper respiratory infection, all those things. So you'll obviously get that in your courses, but we also want you to get it in your clinical experiences as well. Um, so people do their clinical hours at lots of different sites. You can imagine a lot of people go to private practice, OBGYN settings. There are some inpatient settings that work. So like OB triage, there might be some kind of like high risk antepartum settings that could work, or some postpartum sites, kind of depending on geography, sometimes what different opportunities are available. But um, in addition, like Planned Parenthood clinics, community health centers, primary care clinics, student health services, not at Emory, but at other places. We've had students. And then also, you know, OBGYN kind of special subspecialties. So some students will do hours in maternal fetal medicine, reproductive endocrinology and infertility, GYN oncology, breast health, LGBTQ care clinics, urogyne, sexual health. You get the idea. You can you can see a wide array of things. All right. Um, and so the way that we do clinical placements at Emory is that it's a collaborative effort between the students and our entire like clinical placement team that we have. Um, so students are really leading the process where we expect that students are identifying potential preceptors and sites where they would like to get experience. Maybe they have connections there, various ways of connecting or finding a place. Um, it's important to note that it's very different from like maybe pre-licensure nursing where you're told, okay, like you're going to have your clinical on Wednesday and Thursday and your schedule is made for you. For NP school, really it's up to the student and the preceptor to figure out between the two of them how the specific schedule is going to break down. We don't get involved in that. Um, you'll see by looking at the plans of study that there are some semesters where you need 180 hours or 240 hours or 360 hours. And I just wanted to give sort of an idea of what that looks like because, um, again, for our specialty, most clinical sites are like clinic settings. So we'll be sort of a 9 to 5, Monday through Friday situation, which is also different than other specialties, which might have more options for like 12-hour shifts, nights, weekends. Um, so anyway, being mindful that you're looking at 2, 3, 4 days a week towards the end of being in clinical. So if you're working, um, you might need to make adjustments to your work. Some people, as the program progresses, may drop to part-time or per diem or something like that. There's no requirement to do that. You're in charge of you, but um, anyway, it's just good to like give some thought to what this will look like in your life, schedule wise. And then also just wanted to point out that even if you're part-time, the clinical hours in those semesters where there is clinical is the same. So in a semester where someone needs 180 hours, it doesn't matter if they're part-time or full-time, that expectation is the same. So just being aware of that as well. All right. And then just throwing this out there in case you're interested, in case you're someone who you've already decided women's health is your thing and that you want to dive a little deeper. So NPWH is our National Association for Nurse Practitioners in Women's Health. They do offer a discounted student membership. A1 is a little bit broader, so it's Association of Women's Health Obstetric and Neonatal Nurses, but a lot of folks are members there. And then there's also Nurses for Sexual and Reproductive Health, which actually offers a free student membership. So once you're enrolled as a student, there's really no downside to joining that organization because it's completely free. All right, so I'm happy to answer your questions. Thanks for listening to me ramble through that. Just yeah, let me know. Let me stop sharing. Let me know what you're thinking or what needs some clarity.
Hi, good
Hey,
afternoon. Hi. So I am a DNP Psych MP.
I see that.
So
Congrats.
thanks. And I was wondering about what this program looks like for someone who is, this would sound like, it sounds
Yep.
like it would be the postmaster certificate.
Yes. So
And
yep.
what classes would I need to take if I applied?
Good question. So I'll answer more generally that yes, someone who's already a nurse practitioner in another specialty would be applying to like the post-grad certificate program. So everyone's plan of study will be slightly different for that. So if you did you get my email earlier? I can put it in the chat too. But
Uh,
if you will
I
email
do not.
me.
Yeah. I emailed someone, but I
Oh,
haven't
okay.
gotten a response. So
Oh, okay.
it would be nice to get your
Understand.
email.
Sure. Yeah. Um, sorry, I don't my keyboard stopped working right before this, so I'm like having to use
I'll
the
I'll put it
touchscreen.
I'll put it in.
Oh, okay. Thank
Yep.
you. I appreciate it.
Thank you. And
No.
then my other question is, um, I heard you talk about the clinical hours.
Yes.
Are we are we getting our own preceptors?
So, good
And
question.
then you coordinate the contract, or what does that look like?
Yep, good question.
Thank
So,
you.
yep. Um, so so again, I kind of think of it as like plan A is like the student has identified some place they would like to be, and that place has accepted them. And then yes, the clinical placement team from there takes over to coordinate all the affiliation agreement and credentialing and all of that stuff. We know that it's not always that easy, right? So it can be tough reaching out to, if you don't already kind of know people or have connections, it can be tough, like reaching out to clinics. So the clinical placement team is definitely there to like kind of coach you through that. They might ask for kind of like, who have you contacted so far? What responses have you gotten? Because there is some degree of like tenacity that sometimes works, like maybe they told you no for the spring, but they'll tell you yes for the fall or something like that. Um, the clinical placement team is always like working to identify preceptors themselves as well. And so depending where folks are geographically, we might have connections or sites in those areas that we can offer. Um, and then sometimes people do have to go with like the third party vendor route. Emory will reimburse up to a point, and so there's like a process for student reimbursement if you do have to pay a vendor to help locate a preceptor. So it's sort of a multi-prong, method of identifying preceptors. But I would say again that the student is like the lead in that and kind of helping us figure out like where they are, what they're interested in, and then working with us to see what we can find.
Okay, so you will reimburse for the finder's fee,
Yes.
but there are preceptors who will charge. What does that look like?
Okay. So I think that's sort of like a case by case situation. And so I would have to honestly ask the clinical placement team, but you can email me about this too to remind me, and I'll try to get
Or
you a clearer answer.
okay.
Yeah, good questions.
Hi, Lori.
Hey.
A great presentation. I can definitely tell you're passionate about the field, and that's very inspiring and engaging. So, thank you for the presentation. I'm still in a place where I'm evaluating between women's health and adult acute care. So,
Okay.
just
Oh, wow.
more. I know. So just more like your perspective of what's been the most rewarding aspect of being in women's health nurse practitioner.
Yeah.
And then can you also, this is second part, talk a little bit about how you see the field evolving over the next 5 years?
hmm Great questions. It's interesting. Like, I don't feel like we get a lot of overlap of like acute care and women's health, but like I was saying before, it's usually the FNP folks who are, or like the people who are like, maybe I want to do FNP. Um, the reasons I love women's health, I mean, there's a million reasons, but I think I actually really like dealing with kind of difficult topics, like sensitive topics that might make some people feel kind of squirmy. Like I like that. And I think in women's health, we do a lot of that. So, I was mentioning before the kind of like soft skills focus that we have. Like, I think we have to know how to navigate difficult conversations a lot. Not that you don't need that in psych, as Joanne can tell us, or or in acute care, but um, I think also, I appreciate like the continuity of care. Like I like seeing people over and over again for years and getting to know them. And, um, I think that's something that's rewarding. But I think for me personally, like I think we see people, and again, not that this applies only to women's health, but we see people in like really kind of vulnerable times where they might be navigating a lot of like shame or anxiety or things like that. And I don't know, I like helping people through that. So um that's what it is for me. I don't know. I'm sure it's different for everybody, but that's for me. Um Changes in the next couple of years. So um I think like I don't know if y'all are on social media. I'm trying not to be really, but I keep hearing that that like menopause is having a real moment in social media, and um again I think like that's an area where women's health gender related NPs really excel, and so I see there becoming more emphasis on kind of like midlife, later life health and wellness. Our scope goes from puberty to the end of life. And so, people are living longer and we need to address their sexual health as well. I think there's more kind of awareness about that and how it fits into people's overall health and wellness. And these are all areas that we, again, really like excel in. I mentioned some of the other things like of course, like the maternal mortality disparities, the, family planning, reproductive health, policies. Like, I think, some of it's like kind of it's sort of like, let's see how things evolve. But I think, women's health MPs also are well positioned for doing a lot of advocacy as well, like being experts in these areas. So it's, if that's something that interests you, then it's, a nice field to be in because it ties so closely with like how people actually live and thrive. So, yeah.
Well, thank you. I appreciate it.
Yeah.
I'm finding that with me I specialize in reproductive psych.
Oh, nice.
So I think for me, with the menopause moment, that's what I'm calling it. The menopause moment it made me nervous, like, because I have a lot of patients coming in and I can't speak to it and I want to.
Yeah.
But, and I can, but I just don't know how out of scopey it is for me. And so that is why, I have to figure out what it is I want to do because I only specialize in women. So, women and children.
Nice.
So, yes, it's
Well,
really
thank you.
tough. It's
Yeah.
really tough.
Yeah. Well, thank you for the work you're doing. That is tough. Yeah. What else?
Hi, everyone.
Hey.
It's been an incredible presentation. I thank you all so much. There's a lot of you guys are all doing such great work, so it's great to be able to share this space with you all. I'm coming from a non-nursing background, coming into trying to apply for the MN/MSN program. And so I had a question in regards to applying for graduate school. I'm actually looking to see about applying for public health programs and looking for the women's health specialization tracks for certain programs. I wanted to ask about any advice you had in regards to that, if you think applying to those type of programs first and then going into an MN/MSN program for women's health to be able to speak to that from a research standpoint when applying for the application and then just overall my experience in the program later on, hopefully. Just wanted to ask any advice you had in regards to that.
So to clarify, you're looking for MPH programs that have like a women's health special focus or
yeah, so I wanted to see if I'm trying to like figure that out right now currently if I should apply for public health programs that have a women's health specialization first, and then applying for MN/MSN programs just to see if that would be a better just a better option or just another option since I'm coming from a non-nursing background, just to be able to speak for the research standpoint first. So just wanted to see what you thought of it.
I mean, that's another I don't know that there's like any right way, right? I mean, there's a million routes to get to where you want to go. I mean, we certainly have folks who already have had long careers doing other things in public health or research and then come to nursing school. I mean, I think also you could certainly do it the other way around too, where you like do the MN into the MSN or DNP if you wanted to do that. And then even after you're done with that, do the MPH. And Ashley may know better than me, but I think there's also an MPH MSN.
Yeah, I was going to mention that. So, it depends on how much time you want to spend at Emory here, but so we have our MN program, which is a Master of Nursing program. That's an accelerated master's program for pre-licensure students. That's 15 months. It's 4 semesters. And then we also have a dual MS and MPH degree. So you would obviously complete the MN and then apply to that particular degree the first year you spend in the School of Public Health. And then 2 more years, you would spend, well, again, it depends on what plan of study you're going to go for here. But if you go full time for that MSN, it's another 15 months here in the School of Nursing to get your MSN. So there is a way that you could do all three of those within about 3 years, I would say, to do the MN into the dual MPH MSN.
You could even do the DNP after all of that if you wanted to. So any way you want to put the puzzle together, I mean, you could do it. Yeah, and I think I don't think there's a right or wrong way of like the order in which to do it. But I think like nursing and public health obviously go together like really well. So
yes, definitely. Thank you guys so much for the information. Yeah, I was just recently looking to the public health and the MSN dual program. So yes, glad you mentioned that. So thank you very much. I appreciate it.
Yeah.
One more quick question.
Yeah.
Do you host panels of alumni students who have gone through the program at all?
Great question, Melanie. I haven't since I've been the director, but it's been on my mind that I want to. So, do you mean like something like this where it's more public? Because I don't think we've done that, but Ashley can correct me. But like I was thinking about it more like in terms of our inside our courses, kind of like inviting alumni back to speak to folks. But maybe
just like external as well. I think it would be great just to hear, like, as we're evaluating programs, some success stories and, people that have thought about FNP and then decided, like, I'm just curious to hear the insider information, I guess.
So I'm going to put a link in the chat right now. So we have a page on our website called Meet Our Current Students. And we have some MSN DNP students that are in there. So give me just one moment. And that is a great way. So you can actually send them a direct message through the website if you want to get the insider information, because I think a lot of them, as Dr. Ray was saying, are choosing between FNP and women's health. And that is something that we hear a lot. So you could certainly reach out to them to see why they chose the specialty that they did and what their experience has been so far.
Oh, I was muted. I was saying that's so helpful. Thank you so much for sharing that link.
Yeah. Thank you, Ashley.
Yeah, and anybody so we're recording this will be available afterwards on our YouTube page. But anybody who's watching this, you can also go to the website under the admissions tab. That's where you will find the Meet the Current Students webpage.
Any other thoughts? All right. Well, thanks again for joining. Again, feel free to reach out to me if you want to meet one-on-one. We can do that. But I look forward to hopefully seeing y'all apply and seeing you in class and seeing where your journey takes you.
And I'm going to add one more email address in the chat here, and that is nursingquestions@emory.edu. So that's the email for the admissions office here. So if you have any questions during the admissions process, we're more than happy to help you with sort of the technical aspects of how to get that application in, letters of recommendation, etc. Obviously, program questions can go to Dr. Ray, but if you have any other questions about the admissions process, we're more than happy to help you through that. Wonderful. Again, this recording will be available. You'll all get an email from us tomorrow with the link to rewatch this if you would like to. Thanks so much, everybody.